Hi, thanks so much. Thanks for having me here today. My name is Elizabeth Buzney, and I work in Boston, Massachusetts, at the Brigham and Women's Hospital as part of MGB Dermatology. The first thing to do is that you have to get your office ready, and there's a number of things to do. First, you yourself as the dermatologist or physician extender should be trained in proper implant insertion technique. And then the second part of this is it's important to have cold storage where you can store the medication safely. Of course, you want to set up a shipping mechanism where the medication is received appropriately and then able to be stored. And so this requires a good amount of coordination between the EMR that you're using, between your pharmacy, the provider team, and then also the billing team as well. I do find that the prior authorization process is long. It takes, in my experience, around 6 to 8 weeks to get that going. And so it's very important that everything is worked out financially for the patient before they arrive for their first dose. And then once the patient arrives for that visit, of course, I talked about the physician or physician extender having a proper insertion technique, but we also want the entire team to be familiar with our EPP patients, what they need, the setup, so that the visits are efficient and satisfying for them as well. I think that's pretty much it in terms of the practical considerations. I always do, as I think anyone would, I always do a consultative visit first, where I talk all about the medication and I go through all of those practical considerations, including the financial part of it, before we submit the prior auth, and then have the patient come back in for their first treatment. I will say the other thing that I talk about with patients at the initial consultation visit is, what they should expect, how long it takes if they're going to see photoprotection improvement. I talk with them about the normal pigmentation changes that they're going to see. We talk about avoiding excessive UV or tanning behaviors. And then also we talk about how they're going to time their treatments. For example, starting their treatment before a high sunlight season like springtime, so for maximal benefit by the time the sunlight really rolls around. Getting back to your question about pain, there is some pain involved. I inject with numbing medication, which lidocaine with epinephrine before inserting the Afamelanotide, and that numbing medication is painful, just as it would be with any lidocaine with epinephrine injection for a biopsy or something like that. So no different there. I would just say that if you have the opportunity to care for this group of people, it's incredibly rewarding. I think they have amazing stories, and I will say that injecting Afamelanotide, I really do feel like I'm making a difference for them, for the people that it works for. It makes an enormous difference in their lives and their quality of life. For some of them, they start living in a totally different way than they have ever been able to live before. It really feels like, again, making a difference in a way that I don't always do for all of my patients. It's a profound difference in their lives. And they often also feel validated as well because, perhaps they've never been part of a community before where people believe their symptoms and understand how impactful they are, how painful they are. And so, again, it's a very rewarding experience, and I really enjoy working with this group of people.